Hi, I'm Lindsay Maybranch, and I'm going to talk to you about septic shock. What is septic shock? It is a life-threatening condition caused by a severe localized or system-wide infection that requires immediate medical attention, characterized by pathologic vasodilation and shunting of the blood from vital organs to non-invasive tissues. This little picture right here shows SIRS, which stands for Systemic Inflammatory Response Syndrome, and then it goes up to the next step, which is sepsis. Sepsis is severe inflammatory response syndrome plus infection. Severe sepsis is sepsis plus end organ damage, and septic shock is severe sepsis plus hypotension. Patient assessment. Signs and symptoms of sepsis are often nonspecific and include the following: fever, chills or rigors, confusion, anxiety, difficulty breathing, fatigue, malaise, nausea and vomiting, pallor skin tone, and tachycardia. In this picture, it shows Harry in the early septic shock warm phase. Right here it says Harry's face is flushed. His temperature is 103 degrees. E. coli was identified in Harry's urine. Urine is cloudy. Down here it says septic shock cold phase late stage. Patient is intubated. There's a mechanical ventilator. There's pulse oximetry, and his skin is cool to the touch. It is important to identify any potential source of infection. Localizing signs and symptoms referable to organ systems may provide useful clues to site of infection causing the sepsis. Head and neck infections cause severe headache, neck stiffness, altered mental status, earache, sore tooth, sinus pain or tenderness. Chest pulmonary infections can cause cough, can cause pleuritic chest pains, dyspnea, bronchial breath sounds, localized rales, and any evidence of consolidation. Cardiac infection, such as any new murmurs, and this one's especially big to look for in your intravenous drug users. Also, you need to check for abdominal and gastrointestinal infection, diarrhea, abdominal pain, abdominal distension, and rectal tenderness, bone and soft tissue infection, localized limb pain or tenderness, edema, swollen joints, skin infections such as petechia or purpura, erythema, and bullous formations. This picture right here, it shows petechia. It's also, you can also call that purpura, from my understanding. Hemodynamic monitoring and findings. As septic shock progresses, stroke volume and cardiac output decreases. The patient shows symptoms of poor perfusion, including cool skin, cool extremities, and delayed capillary refills. The pharmacological treatment of septic shock. Start antibiotics as soon as possible to kill the infection causing the sepsis. Fluid resuscitation and supportive measures to correct hypoxia, hypotension, and hypoperfusion. Identify the source of the infection and treat with antimicrobial therapy or surgery or both. Corticosteroids are also used for their anti-inflammatory process. Arterial blood gas and mechanical ventilation for septic shock. Arterial blood gases are typically a respiratory alkalosis. This is common in patients with sepsis. This is caused from the stimulation of the medullary respiratory center by endotoxins and other inflammatory mediators. Septic shock can cause ARDS, so to protect the lungs, it's best for the respiratory therapist to follow the ARDSNet protocol of low tidal volumes and higher PEEPs. And this is the works cited page.